Just sit down, shut up, and let's get. Good afternoon, everybody.
Good afternoon. Good afternoon.
Good. I finally got people to respond to. Clerk, please call the roll.
Senator Boswell. Here. Senator Douglas.
Present.
Senator Thomas.
Here.
Representative Chester Burton.
Here.
Representative McCool.
Here.
Representative Pollock.
Here.
Senator Meredith.
Present.
Chairman Hart.
Present. First item on the agenda is the consideration of the minutes of the December 14th, 2023 meeting of the committee. Is there a motion that... I have a motion by Representative Pollock, second by Representative Chester Burton. Clerk, please call the roll.
Senator Boswell.
Here.
Senator Douglas.
Aye.
Senator Thomas.
Aye.
Representative Chester Burton. Yes. Representative McCool.
Yes.
Representative Pollock.
Here. Yes.
Senator Meredith. Chairman Hart.
Yes, motion carries.
Yeah, yes.
Total, excuse me. Total number of items on the agenda today equal 373 in the amount of, let me count my zero, $136,892,596.04. All vendors are registered with the Secretary of State's office. First order of business is on the deferred list, which is item number 32 on the December MOA pink list. There should be a letter in all your all's packets from the Department of Education. If the representatives are here, please identify yourself for the record and come forward.
Good morning. My name is Larry Taylor. I'm the from the Office of Legislative and Intergovernmental Affairs for Energy and Environment Cabinet. Our Office of Energy Policy staff have not arrived yet, but I'll be here to answer any questions you may have on this voluntary program.
Could you pull your microphone closer to you?
Sorry about
And
that.
is the green light lit up?
It is on, yes.
All right, great. If you could, please raise your right hand. Do you solemnly swear to tell the truth, the whole truth, and nothing but the truth, so help you God?
I do.
All right, thank you so much. I believe Senator or Co-Chair Meredith has some questions.
I do? I'll make some up, okay? Hey, Larry, good to see you
Good
again.
to see you too.
Appreciate you being here. No, in all seriousness, what we had last month was a question as to whether this program had been kind of vetted by the Kentucky Department of Education. We
Yes,
asked
sir.
for a letter to that effect. I think it does have their support, but to understand the apprehension, just a lot of programs are directed towards education that requires a lot of resources, and just want to make sure the Kentucky Department of Education was on board with this, and the letter says that they are, and this is voluntary in nature, so really not a question for you today. Just wanted to make sure the committee members understood we did reach out to the cabinet, and they are supporting the program.
Yes, they committed that they would look at the curriculum to make sure that it to see how it complies with the standards.
So thank you, sir.
Thank you.
Thank you, Mr. Chair.
Do we have a motion to consider the contract reviewed without objection? Motion by Co-Chair Meredith, seconded by Senator Douglas. All those in favor vote aye. All those opposed vote no. Clerk, please call the roll.
Senator Boswell.
Aye.
Senator Douglas.
Aye.
Senator Thomas. Representative Chester Burton. Representative McCool.
Yes.
Representative Pollock.
Yes.
Senator Meredith. Chairman Hart.
Yes, motion carries. Next order of business is consideration of the agenda, including the deferred list, personal service contract list, PSC amendment list, memorandum of agreement list, memorandum of agreement amendment list, the entertainment and incentive program agreement list, and the corrections list, except for those items selected for further review. Do we have a motion to consider the contracts reviewed without objection? Motion made by Co-Chair Meredith, second by Senator Douglas. All those in favor vote aye. All those opposed vote no. Clerk, please call the roll.
Senator Boswell.
Aye.
Senator Douglas.
Aye.
Senator Thomas.
Aye.
Representative Chester Burton.
Yes.
Representative McCool.
Yes.
Representative Pollock.
Yes.
Senator Meredith.
Aye.
Chairman Hart.
Yes, motion carries. The first item on the pulled list is with the Department for Medicaid Services and is item number 8 on the routine personal service contract green list. If the representatives are here, please come forward, identify yourself for the record.
Good afternoon. I'm Eric Friedlander, Secretary of the Cabinet for Health and Family Services.
Leslie Hoffman, Deputy Commissioner for the Department of Medicaid Services.
Good afternoon, Lisa Lee, Commissioner, Department for Medicaid Services.
All right, thank you all so much. Could you all please raise your right hand? Do you solemnly swear to tell the truth, the whole truth, and nothing but the truth, so help you God?
I do.
Thank you so much. Co-Chair Meredith.
Thank you all for being here. First thing that caught my attention about this contract, which I want the committee members to be aware of, is it says the payment source is almost 30% federal, agency 70%. And the reason I caught my attention, usually that's reversed for the Medicaid program. At first I thought it may be an error, and this is no, it's not. And Senator Thomas, as I mentioned last month, sometimes I like to pull contracts of this magnitude. This is almost $38 million. So that everybody understands what we're trying to accomplish here and how this programs work. So that's why you folks are asked to be here today, to kind of talk about the financing model, why our percentage is so high, and how this program works. In 10 words or less. Just kidding.
Senator Meredith, thank you for the opportunity today. Yes, this is an odd Medicaid contract. The actual federal and agency is flipped. This is because this is a unique contract. It's a part of what is a budget request. It's a 3-year horizon for implementation, and this is that mobile crisis services. Those of you who know we've been facing a lot of crisis around behavioral health, around substance use, around homelessness. This is the opportunity to really work on the system of folks that go out and deal with those folks who are in crisis. This will allow, among other things, and it's a whole system, but this is a slightly different model, an ASO model, which is different from our MCO model. Senator Meredith, I know that you're happy for us to try a different model there. And what it will do is it will really coordinate those services. So there's a piece that's a 23-hour, 7-day-a-week service, meaning those folks who have behavioral health decompensation on the street, we see it all the time, those folks with substance use issues, rather than take them to incarceration, which puts pretty big burdens on our counties, but allow them to go to some place to actually get some behavioral health assistance. It will also allow for some crisis and some stabilization opportunities for folks that haven't been there before. So this will allow us, and so this is just the beginning part of this. This will allow us to actually address some of the needs that we've seen, not just in urban areas, but in rural areas across the Commonwealth, with folks who have significant behavioral health issues, significant substance use issues. It's an add-on to Senate Bill 50. It's the pre-adjudication piece of that, where folks will be diverted from jails, arrests, into treatment. And that's what this contract will do. And the reason the funding is flipped is this is kind of worst case scenario, but not everybody's eligible for Medicaid. And we don't want somebody to, have to make that determination on the street. So once we start to get experience, which is what this is, we will then know really what that percentage flip is. We gave you the worst case. I don't want to, I hope, Senator Meredith, I do try to under promise and over perform, and that's exactly what we're trying to do in this contract with that fund split.
Are we good? Senator Boswell.
Yes, sir. You made a comment. I think I want to make sure I understood. You said this is just the beginning. You mean this amount of money is just the beginning?
No, this contract is just the beginning. I'm sorry. This contract is just the beginning. There will be funding hopefully funding in future years and future budgets for this. But again, this is the worst case scenario for this contract. I don't expect it, particularly in these next 6 months, to get to this level.
So will we receiving a report maybe at a what period of time as we go through this process? Will we receive a report before the next year, before this money is spent, or we get an interim report?
We're happy to give you any reports as we go along. If you'd like to see it monthly, we will let you know exactly as we go.
6 months maybe. Thank you.
Okay, sure.
Any other questions, comments? Senator, okay.
Thank you, Mr. Chairman. Mr. Chairman, may I ask 2 questions?
Sure, go ahead.
Thank you, Mr. Chairman. My first question is this. Are we talking about persons exclusively who are involved in the juvenile justice system?
No, this is for everybody. This is for all ages.
My second question, if I may,
Go ahead.
Mr. Chairman. Okay. We have a lack of healthcare professionals in the mental health space. Where do they come from that are going to be able to essentially, allow this contract to run its course?
These are not psychiatrists, psychologists who we're asking to do this. These are LMFTs, some peer support folks who would go out. So we think that the level that we're looking at, we should have enough to and again, think of this as a 3-year build. We think we have enough to begin this contract and to start this process. This is the start.
Mr. Chairman, may I, just one more.
Okay, one more.
I thank you for your question, for your answers. I'm really, I won't prolong this torture here. Are we somewhat suggesting community-based persons? I mean, because we're not looking at psychiatrists, we're not looking at psychologists, and so I'm looking in the licensing area where these people are coming from and whether or not the persons who are doing this are going to be licensed persons, and what common baseline can we expect the persons in this space to have in treating persons, and what experience are they going to have in treating persons in this area? Thank you, Mr. Chair.
I can speak a little bit to that. So we have 2 models within this continuum, and one is the Commonwealth model, which will require a licensed person along with somebody like a peer support to go out to the person. As providers go, anybody that is licensed facility here in Kentucky and can meet the requirements to be this new provider type, they would be allowed to provide that service.
Okay. Senator Thomas.
Thank you, Chairman Hart. And I want to say, Secretary Freelander, Dr. Freelander, that what I like about this contract the best is that it's government doing outreach to people. I mean, I believe as legislators, as public servants, we need to meet people where they are. We shouldn't wait for them to come to our door. We need to go out and seek them and give them help, wherever they are. And I like the fact this is a mobile intervention crisis program, that you're going out to meet those people who are among the most vulnerable in our society, who have behavioral health issues. And if we can get to them before they do something that's endangers themselves or others, that's a great thing. So I like the mobile aspect of this mobile aspect of this contract, and I applaud you for once again going out and meeting people where they are.
Thank you.
Senator Meredith.
Thank you, Mr. Chair. Again, $38 million is a lot of money. Within that, $23 million is for non-medical. So can you elaborate on what we would be spending that $23 million upon?
Sure, I can do a little bit of that. About half of that, we are going to partner with local communities and local law enforcement, because a lot of times law enforcement goes and makes these calls I did homeless outreach in Louisville, and what I found was law enforcement, and I believe I would, if I had somebody here from KSP or anybody, they hate to make these calls, right? The calls are going out, they're dangerous, right? In terms, we do have CIT training, which is a good training, but so this is for the community to come up with a plan for how law enforcement will work with this Commonwealth model. Is that law enforcement goes out with a licensed professional, the licensed professional goes out, or the licensed professional goes out and law enforcement's backing them up, or the other way around. And that's for communities to decide. That's not for us to decide. And so about 11 million of that is going to support that effort of really trying to come up with the local models for that. And then the other is really those folks who are not eligible for Medicaid. I guess that's the fastest way I can say that. Who may not be Medicaid eligible, will still need the services, and so there's funding there for that. And those are the two big pieces of that 23.
2 follow-ups, please.
Go ahead.
Within the contract description, and appreciate, we don't get a thumbnail description of these things, but it talks about immigration status. Can you kind of elaborate on that a little bit? Because, we had a lot of attention this last year about illegal immigration, and we don't know what kind of impact it's having on Kentucky. We don't have the money to take care of our own citizens. So what do we mean by immigration status?
Sure. You don't know who you're going to meet on the street. That's all it is, right? Who knows who you're going to meet on the street, and that's so somebody doesn't get caught out, and then because of somebody's immigration status, there isn't some payment behind it. That's really all that is.
You've attended a lot of committee meetings of which I've participated in, and one of my favorite statements is, we never measure the cost of doing nothing. And I think this fits this particular situation. 38 million is a lot of money, but can you project for us what it would cost us if we do nothing here?
Well, yeah, I actually think I can. I was talking with, just before I came over here, I was at the Opioid Abatement Task Force, and they've appointed the treasurer, who used to be the Commonwealth's attorney in Garrett County, and he talked about, before we started putting more money into substance use, that his jails, he was going bust on the jails. That what he was seeing was huge budget overruns because he was putting everybody in jail and didn't have anybody to put them. I hope what we'll see is it will reduce sending folks to jails and hopefully lessen some of that budgetary impact on the local level. I don't have a projection for you, but in talking to law enforcement, right, and listening to jailers, and I guess my own experience with Louisville Metro government, I think this is a lot less expensive than housing somebody in jail for a week, right, or a month, or however long it takes to get to trial. The hope is by getting the treatment right off the bat, you will, and I'm always nervous about, because everybody always says to me as the cabinet secretary, I've got some ways to save you money, and it usually never works. But so I hesitate to speak for them, but I think you could say, and I believe you can say, that we'll see less use of our jail system. That's what this is designed to do, which then could save money on the local levels. That's the real hope.
And
we're not trying to capture that here.
Okay.
But I believe we will.
Then how we evaluate the effectiveness of this program? What's going to be the measures of success? How will we know a year from now that this has been worthwhile?
I think what I just said to you, and we'll have an evaluation piece of this, which will be, how many folks have we impacted? Have we been able to get them to treatment? There are always going to be people out there that will go, this will be the next piece, right? And then we're going to learn as we go. Honestly, we're going to learn as we go. Some people refuse treatment. We know that, right? So what's that success rate? And we'll be able to model that for you.
All right. Thank you. Thank you, Mr. Chair.
Senator Douglas.
Thank you, Mr. Chairman. I'm still struggling with licensed person, and I'm not really hearing a standardized licensed person.
Give the list.
That's number one. Number two, I really have a lot of concern in the law enforcement space for our law enforcement officers who are already overwhelmed and undermanned. And now we're going to be asking them to take part in this program and not only watch out for their safety, but someone who has little to no training in the law enforcement space, watching out for their safety in a potentially life-threatening situation. I still have some concern for that, and I just wanted to express. It's not really a question. It's just, that's just a concern that I have.
And we do too, and that's why it's got to be designed at the local level. I can't say sitting here what's going to work for Maysville. I can't say sitting here what's going to work for Hopkinsville, right? I can't. And I know that. And so that's why the piece of this is for the local planning. I think the list is like licensed LMFT, right? What's the behavioral health one? QMRP, behavioral health associate. So those are actual licensed, certified categories. And that's probably the base level, and then overseen by somebody with a more advanced degree.
Senator Boswell.
This subject came up just recently in a conversation I had with the sheriff of our county in our area. And the question was, what do you do when someone is threatening to kill themselves or threatening to harm others? Now, their answer to me was, we go and pick them up, we don't arrest them, and we take them to the hospital. And then they're treated there. So is this bill, is this the money that's going here, is that to pay for the cost of the hospital stay and the treatment they received if they're on Medicaid, or what is, you know what I'm saying? That's my question.
Right. When somebody threatens to kill themselves or harm somebody else, that's there's a statute, and that's a reason that they can be committed to a hospital for a certain period of time. If somebody's acting up on the street, right, I don't know, yelling at passersby, right, then this would not be for the hospital, because there's a payment methodology already for hospitals and commitment. This is for not going to a hospital. This is for going to someplace where that person can gather themselves, have their medications evaluated, and 23 hours would be the maximum time they could be there. But it's a place where they could go, where your sheriff could go, and not necessarily take them to the hospital if they wouldn't meet criteria, because I've heard sheriffs say they'll get them to a hospital and they'll be out in 6 hours, right? This would get them to a place where they could actually receive some help, but it's not a hospital. The hospital's already getting paid.
Thank you.
Representative Pollock.
Thank you, Mr. Chair. Just a comment. And one of my towns is Campbellsville. And so I really love to hear you say working with local people. When I hear law enforcement, city, police, sheriff department, I can bet that they identify with those already who could possibly need some mental issues and need some help. Okay. I also think it's important that, again, locally, there's non-profit organizations that are helping the homeless, addiction, again, mental health, those type of things. They typically know, again, who they're dealing with on a regular basis. And so when you say working locally is super, I think it's something we need to obviously do. I mean, in that capacity. The other thing is, and Senator Meredith and we in this committee, and I'm fairly new to this, but what is this $38 million going to do and evaluate? And you shared those concepts. We truly don't know, but we have to do something. We just have to do something, and we just want to, I'm speaking on behalf of a committee here, that this a lot of money, $38 million, but if we're working locally and we're trying to put a plan together and we're providing the tools it's going to take to maybe just do a little dent in this mental health crisis that our society is dealing with, I mean, it makes sense. And so if it's sitting where you all are here calling the shots in Frankfurt or wherever you're from and trying to pick and choose and do all that, then, I mean, that's the wrong road. So I appreciate you saying that you're working locally with law enforcement, with those mental health consultants, the nonprofits. I didn't hear you say that, but there are some nonprofit organizations that, again, are boots on the ground, so to speak, trying to make a difference in their communities. And I feel like they're all across the Commonwealth. And so we need to find ways to work together, use some of these dollars to identify those ways and pilot what works, get rid of what doesn't work, and find a way to make a change. So, again, that's just a comment. That's my observation, what I've kind of seen. Value your point on that.
And these will be pilots because we're going to have to learn as we go. Absolutely. Yes, sir.
All right. Representative Chester Burton.
I appreciate you being here today. I want my colleagues to, when they get a moment, take time to read an article, something that we just had happen in Jefferson County regarding a mental health call, and that the officers showed up on the scene. And what I think would have made a difference with the outcome of that is if they had had a mental health professional with them. So the bottom line of what happened when that particular incident occurred a few days ago is that it wound up not being a good look for LMPD because they actually went in and took control of the situation. But the person that they were trying to remove had a situation going back and forth with it. So it escalated. So I think the more we can get mental health professionals to tag along, to be part of the solution, the better. So to my colleagues, when you get a moment, you can read that article on WLKY regarding the mental health crisis that occurred with LMPD. Thank you.
Okay. All right, if there's no other comments, do we have a motion to consider the contract reviewed without objection? Motion made by Representative Chester Burton, second by Co-Chair Meredith. All those in favor vote aye. All those opposed vote no. Clerk, please call the roll.
Senator Boswell.
No.
Senator Douglas.
No, but explain my vote, please.
Yeah, go ahead. Sorry.
Okay, thank you, Mr. Chairman. I think there are a lot of great people with a lot of great ideas. My concern now, and my concern since I've come to the General Assembly in reviewing things, is that often we treat the results, but we really don't treat the cause very, very well at all. And we continue to treat some of the causes in the same fashion without really any good results. So we decide we're going to treat the consequences. And I see the numbers continually go up. Maybe I'm the only one who's seeing the numbers that are involved continually go up. That just may be me. I'd like to see us at some point do some cost shifting. Instead of putting money in the same bucket all the time, when we see the numbers continuing to go up in that bucket, can we, I'd like us sometime to consider saying that bucket is full or it's got a hole in it, it's not working. So let's take some of this money that we're putting here and shift it. If we don't want to treat the cause, let's not treat the cause. Let's go ahead and just treat consequences. But let's kind of make up our mind where we want to put our money in that basket or where we want to put our money along that trail that's going to help someone. And myself, I continually see us doing the same thing over and over and over and over, adding more money and more money so we can reach more people. But our numbers keep going up. And in medicine, the definition is if you're trying to fix something and your numbers keep going up, you're doing it wrong. And that's not a knock on anyone. It's not a criticism of anyone. It's not a saying that you don't know what you're doing. It just means that eventually someone's going to die because you're not correcting it, or a lot of people are going to die. And that's the concern I have here, is that we keep going down the same path, putting money in the same spots, knowing that we're not doing anything. If there are 5 little fish ponds along the road, and we keep fishing in the one that has no fish in it, we're not going to catch anything. At some point, we have to decide we got to move to another pond, or we got to move to the pond that has fish, and let's fish in that and see how that does for a while, and leave the pond that's not producing alone for a while, see if it repopulates. So I don't know if it makes any sense to you all, but I think we've got some great ideas. My concern is that we keep dumping money, and we keep dumping money, and the numbers keep growing, and we don't make changes. So again, I say no, Mr. Chairman.
Okay, thank you.
Senator Thomas.
I vote aye, and I'll briefly explain my vote. As I've already articulated, I like the fact this is a project that goes out and meets people where they are, people who are in need, people who are crying for help, and who oftentimes don't get the help that they need, and then we read about it in other tragic ways. So you're being proactive here, Dr. Freelander. I commend you, and so therefore I vote aye.
Representative Chester Burton.
Yes.
Representative McCool.
No.
Representative Pollock.
Yes.
Senator Meredith.
I'll explain my vote.
Yes, go ahead.
Thank you. I know it's been a long day for all of us. No, we have my vote is aye. We have a great fiduciary responsibility to the people of this Commonwealth. Our budget this year, including Medicaid funding, is going to be right at $30 billion. And even with that, we're not going to begin to meet the needs of the majority of the people who have come to us during this interim session. If the general public understood how staggering that is, I think they would truly be amazed. So you got to make some real hard decisions about where we spend money, how we establish priorities. And there are people that think that we shouldn't do anything at all. But if we do nothing, then the problem doesn't go away. And that's why I asked the question is, do we measure the cost of doing nothing? And I'd like to say I'd like to use this money for something else. But I know if we don't attempt this, that the burden's going to fall to our law enforcement. It's going to fall to our emergency departments. It's going to fall to county government. The cost is there, and it's astronomical, I think, in comparison to this. I certainly want to see results. I ask for it every time that we're in a committee meeting, and we are in this committee as well. And this is a little bit of a gamble. But again, to do nothing is, I think, almost immoral. We do have a fiduciary responsibility, but we also have a moral responsibility. And these are some of the folks who are suffering most in society. And there, before the grace of God, I guess I go why. But I tell you, I don't want to spend this money, but I think it would be irresponsible of me to say, no, we're not spending this money, because I know that cost is there in some form or fashion. And I think we are exercising our fiduciary responsibility when we try to find solutions to problems that they just can't continue to perpetuate themselves. So again, I vote aye.
Chairman Hart.
Yes, motion carries, and we'll move forward. Thank you guys for coming.
Thank you so much.
The next item on the pool list is with Morehead State University, and is item number 5 on the PSC 10,000 and under goldenrod list. If representatives are here, please identify yourself for the record and come forward. Oh, they're virtual. Okay.
Yes, I'm virtual. I'm Jen O'Keefe, Professor of Geology and Science Education in the Department of Engineering Sciences.
All right. Thank you so much. And could you please raise your right hand? Do you solemnly swear to tell the truth, the whole truth, and nothing but the truth, so help you God?
Yes, I do.
All right. Thank you so much. Co-Chair Meredith.
Would anyone else like to take this one? It's retroactive approval request. And I appreciate you being here this morning. This is a small contract, but in the 5 years I've been on this committee, I've preached this sermon on how many times. I'm looking at the letter that I received for justification for this, And the second sentence says the necessity of this process was not communicated to the PIs. What are PIs? I don't know that.
Principal investigators. It's the federal government's wording for people in charge of the grant.
Well, that's enough to be concerned right there. The last sentence is now we're aware of the process. Timely filing will take place for future awards requiring services. Well, I've been promised this before. And again, this is a small contract, but when I was in hospital administration, we used to teach a program that focused on customer service. And we had kind of a quote that said, in an airline, if the flip down trays have coffee stains on them, then that means that we're not doing engine maintenance. And I share this with you because this is this. If people aren't aware of this process at the lowest level of organization, what problems are we having at the upper level of our organizations? And it just concerns me anytime somebody brings this retroactive approval to us, particularly since I've preached about the last 5 years. They know that it causes problems. I think it damages the credibility of the university, anybody who presents this to us. And again, I don't have a question for you today. It's just I don't think this is acceptable, and I'll never find it acceptable except in extreme circumstances, and I don't see this as an extreme circumstance. That's all I have, Mr. Chair.
Senator Thomas.
I know this is going to surprise my colleague, Senator Meredith, but I agree with completely on this one. Because right is right. And ignorance of the law is no excuse. I mean, this is bad. It is a small amount, and I'm going to go vote for it. But I think Morehead State does need to be admonished in this instance, because we can't keep having, these type of after effect approvals, and it's really it really flies in the face of the fact that we are stewards and guardians of state funds. That's our bottom line. And at some point, I'm going to tell you, I'm going to vote no on this if I continue to see this. I'm going to vote yes today, but I do support the frustration expressed by Senator Meredith, and I do want to say that. I want to put that on the record.
I have one. The only comment I'd like to make is, this has been said multiple times over multiple years in this committee. When we receive retroactive contracts, it prevents us from carrying out the tasks that we've been set forth by statute for oversight. And so, like my other colleagues have already mentioned, I'm going to vote for the contract, but I just want to try to impress upon Morehead State, let's try to do better next time, because at some point, things like this will, lack of a better term, come to a head, and we will start disapproving contracts. So, any other comments? If not, clerk, please call, or do I have a motion to consider the contract review without objection?
So moved.
Motion by Senator Douglas. Do I have a second? Second by Representative Chester Burton. All those in favor vote aye. All those opposed vote no. Clerk, please call the roll.
Senator Boswell.
No, just symbolic no.
Senator Douglas.
Aye.
Senator Thomas.
Aye.
Representative Chester Burton.
Yes.
Representative McCool.
Yes.
Representative Pollock.
Yes.
Senator Meredith.
Let's be my vote. I'm a no. And again, I've been in this committee since 2018, so I got some years on me. We've talked about this, and I won't say we've had a marked improvement in the number of retroactive contracts that are brought to us. A marked improvement. At one time, it used to be dozens at a committee meeting, so these are rare. But people need to understand going forward the standard, at least for me, on retroactive approvals. In all the years I've served on this committee, I've only seen one retroactive approval that I found acceptable, and that's when we had a fire at the Kentucky Center for the Arts, and they had to obviously bring in people to take care of that, and they had to do it on a timely basis. That's acceptable. But what I'm seeing is we just didn't know, or folks weren't aware. That's not acceptable. So again, my standard going forward, I hope people understand it, and I'll always vote no otherwise. Thank you.
Chairman Hart.
Yes, motion carries. Contract moves forward. Thank you so much for being here.
You're welcome.
The next item on the pool list is with the Attorney General and is item number 21 on the routine MOA pink list. The Attorney General's office has requested a deferral on this contract. Do I have a motion for a deferral? Motion by Co-Chair Meredith and a second by Representative Pollock. All those in favor say aye. All those opposed say no. Clerk, please call the roll.
Senator Boswell. Senator Douglas.
Aye.
Senator Thomas.
Aye.
Representative Chester Burton.
Yes.
Representative McCool.
Yes.
Representative Pollock.
Yes.
Senator Meredith.
Aye.
Chairman Hart.
Yes. Motion carries and contract moves. It's deferred. Boy, take me a little bit to get that one out. The final item on the pool list is with the Department of Public Health and is number 68 on the routine MOA pink list. If representatives are here, please identify yourself for the record and please come forward.
Hi, I'm Amy Harrington with the Kentucky Department for Public Health.
Bob James, Assistant Director for Department for Public Health.
Andrew Yunt, Director of Administration Financial Management, Public Health.
All right, thank you all so much for being here. Could you please raise your right hand? Do you solemnly swear to tell the truth, the whole truth, and nothing but the truth, so help you God?
I do.
Thank you so much. And Co-Chair Meredith.
Thank you all for being here this afternoon. I'll admit I'm suffering from vaccine fatigue. The last 3 years, we have seen so many contracts related to vaccines, and I'm quite tired of seeing them. That's not an indictment of you folks or this program, but it just seems it's never ending. The agreement description is to provide funds to increase vaccine uptake services. What does that mean?
Increase rates of vaccination.
Why don't we say that instead of? And how will we do that?
How will Sterling Health do that?
Yes.
In the individuals that would be served via this grant would be those individuals that are homebound, so they have no access to health care. Okay. So they would be taking the vaccine into their homes in order to provide those vaccines. Additionally, the other populations served are those school-aged children that may or may not have access to vaccine or a primary care provider in order to provide those vaccines. So Sterling Health has school-based clinics in 6 counties, and then they would communicate with parents as well as individuals in the community to provide vaccines in those settings that are very convenient for the populations that are being served.
And what vaccines are we talking about?
So for the school age, it's back to school vaccines: tetanus, MMR, measles, polio. For our homebound population, those individuals would be eligible for those vaccines, but we must also consider those vaccines that you provide in the respiratory seasons in the fall, which would include COVID, flu, and RSV, because those are associated with increased hospitalizations, increased mortality, morbidity in these vulnerable populations.
Well, the COVID is probably what's got my attention more than anything, because it has received so much attention over the last 2 or 3 years, and I think the general public is still suspect as to the efficacy of the vaccine and whether it has side effects, and I think that's still yet to be determined in total. So is there an attempt to sell people on the COVID vaccine, or convince them that they need it when maybe they really don't want to take it?
So this is a grant that was applied for by Sterling Health, and those clinicians, knowing the populations that they interact with, that are patients within their communities and within their clinics make the decisions on the vaccines that they would promote for individuals as well as groups. So we must leave that to the decisions of the clinicians. They have their ongoing relationships with those patients to have education and outreach that's most appropriate for those individuals. Did I answer your question,
Kind of, sort of. Give me like a practical example. In particular, I'm interested in the homebound folks. First, how does Sterling become aware of these folks? Who's the referral source for?
I think there's 2 points of referral source. One is the local health departments. I have a list, many of our communities have a list of those individuals that are homebounds. We also have referral systems through our senior citizen centers. Meals on Wheels, they recognize and understand who's homebound. And then Sterling Health also has individuals that are on, that are patients of their clinics that are homebound. So collaborating with their community health worker, they'll reach out to those community agencies to identify individuals that are unable to and may not have transportation, may not have ability to travel outside the home to get the vaccine outside of their house. They'll reach out to those individuals, is my understanding, and ask them if they're interested in the flu vaccine, the RSV vaccine, the shingles vaccine, the pneumonia vaccine. And then if they say yes, then they would make arrangements for those vaccines to be transported to the house. So those clinicians, based on the information they've received about the age, gender, sex of the individual in that community, make clinical decisions on what vaccines are most appropriate for that population, and then perform outreach accordingly.
All right. Thank you. That's all I have, Mr. Chair.
Any other? Representative Chester Burton.
Oh, thank you. I just had a question. And what counties are we looking at?
So this is Sterling Health, and they serve Nicholas, Montgomery, Powell, Bath, Bourbon, and Clark.
Okay. That's all for me. Thank you.
Thank you.
Senator Douglas.
I'm just, thank you, Mr. Chairman. Looking for just a little bit of clarification. First of all, we talk about our homebound. Are these, is this a group that is primarily doing telemedicine? Because I hear you speak of patients who have relationships with the clinician. And I'm trying to figure out if that relationship is through telehealth, because if they have a relationship with a clinician who is going to see them, I'm not sure why they can't get a flu shot or get a vaccine when they're seeing a clinician, number one. Number two, I'll just leave it at that. I'm just looking for clarification there, if I can.
So one of the things that we don't do is create an operationalizing plan for Sterling Health. They come forward with their plan. So I can't answer directly your question if this patient has an established telehealth relationship. One would assume if they cannot come into the office and they are treated via telehealth, that they couldn't come into the office and receive a flu shot as well. But that's my perception. Sterling Health has communicated with us that they know that they have homebound individuals that reside within 6 counties, that some of these patients are patients of their clinic and some are not. And they would like to be able to provide a service to protect those individuals from increasing hospitalizations.
One last question, Mr.
Sure,
Chairman.
go ahead.
Is there any way that you could work with Sterling Health and give us some idea of the numbers? Because we're talking about $93,000. I just want to know, how many people are we serving?
How many people, homebound individuals?
We've established that this money not only is for homebound, but also for some school-age children.
That's correct.
And I'm just trying to get an idea of the numbers.
Of the individuals that...
the number of individuals who will be served. Because we've got a number that we've put down. And therefore, with all due respect, I assume that someone has looked at the numbers of people that are going to be serving with this particular number. So if they have a number, I assume they have a number of people that they've already determined are going to need this.
Sure.
So I would just like to have some numbers, if you would, please.
Absolutely. I think the other thing that we have been talking about the vaccination for the homebound, knowing that Sterling Health has school-based clinics in multiple counties, then we can get the school population in each of those buildings.
No. Because the school population in each of those buildings aren't going to need to be treated by Sterling Health.
But they would be eligible to receive.
They may be eligible, but I thought we were now looking at children who don't have access. So we're either looking at children who don't have access to health care, or we're looking at all the children.
Well, it says children who may not have access due to transportation challenges, lack of providers, or other challenges related to vaccination access.
But if we include all the children in the school, I'm lost. Because now we're looking at the entire population not fitting into one of those categories, which means there is a population that is kind of out there by themselves and nobody's working, nobody has cars, nobody has an opportunity to take their children to the doctor. And I don't think that's the case here.
No, I don't think that's the case, Senator Douglas. I do agree. But I do think that when a school-based clinic is in place in a building, an elementary school building, then those providers must serve anyone who presents for vaccine.
So the intent of this, and I'm not trying to be difficult. So the intent of this is not just to serve those kids who otherwise don't have a physician or have access. Correct? Because we're already saying that we're going to serve them all. We have to serve them all.
No, we need to make the service available for all of them.
Correct. So
And
we're not just making the service available for those kids who don't have access.
That's correct.
Okay. The only reason I say that is that let's say that in the contract. Let's not mince words of saying we're going to do this for those who don't have access to health care. We're just going to say we're going to put that out there, and anyone who wants to have this done, we're going to do it. That's all I'm asking. That's all I'm asking, because otherwise we are misleading our public. It is federal dollars, and people of the Commonwealth do pay into federal dollars, but the people across the country also pay in the federal dollars. And I want the people across the country to know, to have some truth, which is we're going to put this money in there, and any of the children who want to take advantage of this, or any of the families who want to take advantage of this, we're going to make this available. When we say we're just going to make it available to those who are indigent, or those who are this, or those who are that, we're actually lying to the public. That's my point. And I just want to stop lying to the public.
I appreciate your feedback. So.
Okay, thank you.
If there's no other comments or questions, do we have a motion to consider the contract review without objection?
I make a motion.
Motion by Representative Chester Burton, second by Senator Thomas. All those in favor vote aye. All those opposed vote no. Clerk, please call the roll.
Senator Boswell. Aye. Senator Douglas.
Aye.
Senator Thomas.
Mr. Chair, I'd like to explain my aye vote.
Go ahead.
It's 2024, and I must tell you, at this point, I am past the period of debating the efficacy of the COVID virus. I've taken all my COVID shots. I take the flu shots. I take the RSV vaccine because they save lives, and I want to be around for a long time. So that's where I am. And if we can make the COVID vaccine and flu vaccine, RSV vaccine available to children, and these are dollars that can be used in that purposes, I commend that. So I'm going to vote aye on this contract.
Representative Chester Burton.
Yes.
Representative McCool.
Yes.
Representative Pollock.
Yes.
Senator Meredith.
Aye.
Chairman Hart.
Yes, motion carries. Thank you so much for being here.
Thank you for your time.
Let's see. The final item on the agenda is the consideration of 8 exemption requests. You can look at them in your packets. Do I have a motion to approve the exemption request? Motion by Representative Pollock. Do I have a second? Second by Representative McCool. All those in favor vote aye. All those opposed vote no. Clerk, please call the roll.
Senator Boswell. Aye. Senator Douglas.
Aye.
Senator Thomas. Aye. Representative Chester Burton.
Yes.
Representative McCool.
Yes.
Representative Pollock.
Yes.
Senator Meredith. Aye. Chairman Hart.
Yes, motion passes. Before we adjourn, I want to just announce our next meeting will be February the 13th, the second Tuesday of the month, and will be upon the adjournment of both chambers. Thank you, guys.